Hi, it's my pleasure to present Dr. Goldenberg, who's the chief investigator of the MADIT-CRT long-term outcome study. Dr. Goldenberg is from Sheba Medical Center. Dr. Goldenberg, thanks for joining us today.
Thank you for the invitation.
So you're presenting the late-breaking trial of the long-term outcomes from MADIT-CRT. Can you give us a background as to what that trial actually is about?
Okay. So MADIT-CRT was the first clinical trial to show that early intervention with cardiac reconstruction therapy is associated with a significant reduction in the risk of heart failure or death in mildly symptomatic heart failure patients. However, possibly due to the relatively short follow-up time of the trial, which was 2.4 years, the study did not show a significant reduction in the risk of all-cause mortality with CRTD. And therefore, currently it is unknown whether treatment with cardiac reconstruction therapy can improve survival in this population. And this was the aim of the present study. We hypothesized that a pronounced reduction in the risk of heart failure events during the in-trial period of MADIT-CRT would translate into a long-term survival benefit.
Great. So can you tell us what the results actually showed?
Yes, we showed that after more than 7 years of follow-up, treatment with CRTD was associated with more than 40% reduction in the risk of all-cause mortality. At 7 years of follow-up, the rate of all-cause mortality among patients with ICD was nearly 30% as compared with 80% among those randomized to CRTD therapy. So there was a more than 40% reduction in the risk of all-cause mortality, but this was restricted to LBBB patients. Patients without LBBB, RBBB, or IVCD who enrolled in the trial did not gain any benefit from the device, or even there was a trend for harm in this population, which should be another implication of this study.
Great. So where do you see things going from here on out, and with respect to CRT, also CRT trials?
I think that CRT should be now implemented very early in the clinical course of patients. We now have evidence that mild heart failure patients gain a significant survival benefit during long-term follow-up. Maybe now this should be extended to stage B heart failure patients who are entirely asymptomatic to prevent the development of the disease. I think this is the way to go, to intervene early to prevent advanced heart failure.
Great. Thank you very much. This is Ammar Killu with FITS on the Go with Dr. Goldenberg. You can catch more videos on youtube.com/FITS on the Go.